Hi, today I'm going to be talking about epilepsy. Epilepsy is a brain disorder that you have a lot of seizures. People throughout their life might have one seizure, two seizures. That's normal. Everybody usually gets one. Epilepsy is when you have a lot of seizures through the course of your life. You can get epilepsy from sports injuries, from birth genetically, and from all other complications that can go wrong in your brain. Epilepsy does not have the awareness, but from the Centers of United Disabilities of Epilepsy, they recorded that there's 50,000 deaths every year from epilepsy, and there's only 39,000 from breast cancer. This is just to show the severity and how much epilepsy can really do damage. There are 3 different types of seizures. WebMD gave me this information. There's generalized, partial, and absence seizures. Generalized, it covers the whole brain, and people are more likely to convulse, fall to the ground, and be unconscious. Partial seizures are when a person can lose some control of their body. It's only on one part of their brain, and that usually controls just usually one side of the body to become unfunctional. Those can sometimes go unnoticed, but those are usually the type that can happen through a person's life that's normal and sometimes won't notice it. Absence seizures usually happen in children. Those are the seizures that definitely go unnoticed. Blinking of the eyes, slight odd hand movements, maybe just a jitter or something along the lines of that. It's completely common. Another way a lot of children have seizures are with fevers. That can happen, and it's very common. There are many triggers. Most people just know about the strobe lights. That's an obvious one. Blinking lights, it causes the brain to not know how to react. So the brain goes into overdrive and is trying to react to all different signals. But as we know, epilepsy is when the brain has too many signals and they don't know what to do with it. So it's the confusion of signals. So the lights can really bother that because everything's happening so fast. Sleep deprivation can also cause this because your brain needs the sleep to understand and be able to know what you're going to do. Stress, obviously, you're overwhelmed, your brain's overwhelmed. It's trying to deal with all of your thoughts as well as keep you going. Missed medication for an epileptic, you have to take your medicine. If you don't, that can cause serious problems, and I'll get to that later on. And alcohol. Drinking alcohol can cause you to have seizures because, again, it's something that your brain has to use and it's not used to. The treatments for epilepsy, there's medications, surgeries, and medical marijuana. Medication's the most common. Almost everybody that's epileptic takes medicine. This medicine controls the amount of seizures and how strong the seizures will be. So if you have seizures all your life and you have them every single day, the medicine might stop it and make it every other day or make it not as bad. But there's no cure for epilepsy. I'm going to make that clear right now. There's no cure, just ways to slow it down or the process to not be as serious. Surgery, again, it doesn't cure it. One of the most common surgeries, all of the surgeries are open brain surgeries, so there's a lot of risks with that. There is the corpus callosum severing surgery. That's when there's 2 hemispheres of your brain, as most people know. The left hemisphere controls the right side of the body, the right hemisphere controls the left side of the body. Now, if you cut the corpus callosum, the brain does not control the side it used to. So the left side now has to control the left side of the body, the right side of the body. Now this gives a lot of complications because you have to relearn how to do things. Your brain has to understand how to do new things because it can't pass the information back and forth. There's also lifestyle changes you'll have to do. Doesn't matter if you get the surgery or not. There's also the medical marijuana that could help, but it's a drug and it's only legal for medical purposes, and it can still make you sluggish and tired. So that's why most people use medicine. So marijuana, medicine, all those can have lifestyle changes. But the main thing is if you have epilepsy, you're going to have lifestyle changes. There's driving. If you have a seizure within a certain amount of time or they're playing around with your medicine, they're going to take your license away. You're not going to be able to drive, which that can give you complications with work, school, and anything. A lot of people that have severe epilepsy, they can't work. They're on disability. Education. A lot of people are protected under the Disability Act, gives them special treatment at school, and even in the workplace also. Employment's a big deal. Because people with epilepsy, their brain can work slower. It doesn't work as fast, and they have to think longer for things to work and for them to understand things. One important thing for every epileptic to have is a medical bracelet. This is a medical bracelet, and on the back it has the information. This gives the people, if you do have a seizure, it lets them know that you're epileptic, that you're used to having seizures, because not everybody that has a seizure has to go to the hospital. And if you have a bracelet, it lets people around you know that it's not as serious as they might think because you're used to having them, but also that it reminds them that they need to take steps to help you. And you should always tell the people around you that you have epilepsy and the steps that they can take if you have a seizure. So what to do if you have a seizure is, if you see a person having a seizure, you try to remove every loose object that could, every unloose object. So if there's a necklace or anything like that, you want to take that away. You want to move sharp objects away from them, and you want to try to hold their head up or tilt them on their side. And this is if they have generalized seizures where they're convulsing. If they have partial or absent seizures, you usually won't even notice it, and those are usually just fine. Just give them some time, they might be confused. But for generalized seizures, you need to hold their head or turn them on their side. You have to try to time it and wait for the seizure to be done. You cannot put anything in their mouth. That's a myth. A lot of people believe you can put something in their mouth and it will stop them from swallowing their tongue. That's also a myth. You cannot swallow your tongue. But they can throw up or urinate, and the vomiting can cause choking. So that's why we turn them on their side. Now, you have to try to time the seizure, which can be hard, but as long as you have a general time, then that'd help, a minute, 30 seconds. If it's over 5 minutes, or if the person is to not wake up, or if they are to urinate or vomit, then the police or hospital needs to be called. You have to call 911 in that case. If you know they're epileptic, and that's where the medical bracelet comes in, if you know they're epileptic, then you can wait for the seizure to be over, and when they wake up, kind of calm them down, make sure everything's okay. Don't get a lot of people in their face, but just wait for them to wake up, and they're going to be nervous, they're going to be scared, so just talk them through it, make sure they're okay. And after a little while, they might just have to sit there, but they probably most likely do not have to go to the hospital. And this is very important because epilepsy doesn't have the awareness. So if a person's to have a seizure on the street, somebody might just go up to them, stick something in their mouth because that's what they think they're supposed to do. But that's not. A person could choke, and that's how a person can die from epilepsy, as mentioned before. More people die every year from epilepsy than they do from breast cancer, which is very serious, and most of that is because there's no awareness for it. People don't know how to react. More people know how to react, then there would be less accidents. So this is more of a public service announcement in a way, because I think it's very important for people to learn about epilepsy and learn what to do if they have a person on the street having a seizure. So thank you for listening, and I hope you learned something.